Swayam Prabha. Digital India. Educated India.
Hello, I'm Dr. Rose, Assistant Professor, Department of Anatomy, Government Medical College, Thrissur. In this session, we will be talking about fetal circulation. It's a very important topic as far as undergraduate classes are concerned. Now, when we discuss this topic, you need to know which are the competencies according to MCI you need to know when you study this topic. The first competency which is expected from you is describe fetal circulation and changes occurring at birth. The next one is describe developmental basis of patent ductus arteriosus. So you have to keep these 2 points in your mind so that at the end of this session you will be able to answer these 2 questions. Okay, so let's begin. This is actually a specimen which I got during my PG days. This is done by me as part of my thesis. So this is a condition known as common truncus arteriosus. So what do you mean by common truncus arteriosus? You can see that this is right ventricle and this is left ventricle. Okay, and these 2 probes are actually passing through a common conduit. So this common trunk is known as common truncus arteriosus. Usually what happens is from the right ventricle it enters into the pulmonary trunk, and from the left ventricle you have the aorta. So truly speaking, these 2 should be directed through 2 different paths. But since there is an absence of conotruncal ridge which separates this common trunk into pulmonary artery and aorta, there is only one single trunk which is opening into right ventricle and left ventricle. So what happens is the outflow tract remains as a single tract. That is what is happening here. And this will be usually associated with ventricular septal defect because you have the ventricular septum formed like this. So the upper part of the ventricular septum is actually formed by the lower part of the conotruncal ridge. So you have the conotruncal ridge dividing the common trunk into pulmonary artery and aorta. So the lower part of this ridge will come and fuse with the ventricular septum. That is how you get an interventricular septum. So if there is any defect or there is defective formation in the conotruncal ridge, what happens is there will be a defect in the formation of interventricular septum. That is the reason why if you have common truncus arteriosus, you will get associated ventricular septal defect. So we will move on to fetal circulation. So in fetus, we know that there is no gas exchange in the lungs because the lungs is not functioning in a fetus. There is no air entry into the lungs. So as a result, what happens is the pulmonary vessels are constricted because they are not properly functioning. So these vessels will be constricted. So when you think about fetal circulation and when you write about fetal circulation, you have to mention 3 important structures. One is ductus venosus, the second one the foramen ovale, and the third one ductus arteriosus. These 3 important points you should mention when you write about fetal circulation. So where will you look for ductus venosus? This point you will get ductus venosus. Then this is the point known as foramen ovale, and this is actually known as ductus arteriosus. Okay, so these are the common things which you get: ductus venosus, then you have the foramen ovale, and then you have the ductus arteriosus. This is 1, this is 2, and this is 3. So for a quick recap of the topic, I will just show the important landmarks which is mentioned in this diagram. You know, this is the heart with 4 chambers. You have the lungs here. You have the head and neck and the upper portion here. Then you have the placenta here, and here it is the lower part of the body, and this is the liver. Okay, so this is just an outline of this diagram. When we discuss about fetal circulation in detail, I will be mentioning each and every component of the fetal circulation. So when you're asked to write about fetal circulation, these 3 points, ductus venosus here, foramen ovale, and ductus arteriosus, these 3 points should come into your mind. Now, oxygenated blood from the mother, that means through the placenta, reaches the fetus through umbilical vein. So we have already mentioned that this is the placenta. Okay, so from the placenta, the direction of arrow is this, isn't it? So from the placenta, so this is the part of mother, and the entire remaining part actually belongs to fetus. So the point which is mentioned here is the oxygenated blood from the placenta reaches the fetus through umbilical vein. So this is our umbilical vein, this red colored region. Why this vein is colored red? That means this umbilical vein and umbilical artery is not like our ordinary artery and vein. Here when we say it as umbilical vein, this is actually carrying oxygenated blood, in contrary to our normal vein which carries deoxygenated blood. Okay, so you have the placenta here and you have the umbilical vein carrying oxygenated blood to the fetus. So there are mainly two umbilical arteries and one umbilical vein in the umbilical cord of a fetus. So one single umbilical vein will be carrying the oxygenated blood from the placenta to the fetus. So once the blood in the umbilical vein reaches the portal vein, so in the liver we know that there is portal vein which is divided into right and left branches. I will just show you how it is. So this is a portal vein and this is the left branch of portal vein and this is the right branch of portal vein. Okay, so our umbilical vein will reach the liver and it will enter into this is our umbilical vein. Okay, and it will enter into the left branch of portal vein. So once it reaches the left branch of portal vein, it has got two options. One is it can enter through the ductus venosus, which is actually a bypass channel, in order to reach the inferior vena cava. That is one option. Or the next option is it can enter into the liver and it can occupy the liver sinusoids, and through the hepatic veins it can enter into inferior vena cava. So ultimately the blood is reaching inferior vena cava, but through two options. One is through the ductus venosus, which is actually acting as a bypass channel. From the left umbilical vein, you have the left branch of portal vein into which it is entering. Then this is the ductus venosus, which is actually opening into inferior. This is the inferior vena cava. Okay, so that is actually a shunt. Why you need ductus venosus, which is acting as a shunt? The reason is, if the major quantity of blood, the major amount of blood passing through the umbilical vein is entering into liver, it will get deoxygenated. So our main purpose is to take this oxygenated blood to the developing brain. Okay, so we cannot waste the oxygenated blood by passing through the liver, but still liver needs blood supply. So a major portion will be shunted to the inferior vena cava through ductus venosus, so that the inferior vena cava will be again having oxygenated blood. But a minor quantity will be going to the liver in order to supply it, and through the hepatic veins it will be re-entering into inferior vena cava. Now when the blood reaches, this is our right atrium. Okay, so when the blood reaches the right atrium, this is our inferior vena cava. Most of it is directed through foramen ovale into the left atrium by the inferior border of, this is the septum secundum. Okay, this is known as septum secundum. Okay, so through the septum secundum, the inferior border of septum secundum, the blood will enter from right atrium to the left atrium. So this opening is actually known as foramen ovale. So once again, as the blood reaches the right atrium through the inferior vena cava, one more thing you have to keep in mind is the blood through the inferior vena cava is oxygenated blood and not deoxygenated blood. So when it reaches the right atrium, it will travel into the left atrium through foramen ovale, and that is actually passing through the lower border of septum secundum. So this is septum secundum. Okay, this is septum secundum. And through the inferior border of septum secundum, it will pass through the foramen ovale into the left atrium. Now, in the left atrium, what happens to the blood? It is mainly oxygenated blood, we know. So the oxygenated blood from inferior vena cava will get mixed up with the blood which is coming through the pulmonary vein. So this is our pulmonary vein. So pulmonary vein is slightly blue in color. So that means it is having deoxygenated blood in very smaller amount. But still, when it reaches into the left atrium, that will get mixed up with the oxygenated blood which is entering into the left atrium through inferior vena cava. Now, what will happen to the blood in the left atrium? It will enter into the left ventricle and it will come out through the ascending aorta. Okay. So from the left atrium, it will pass into the left ventricle, and from the left ventricle, it will ascend up through the ascending aorta. Now, blood in the ascending aorta is well oxygenated compared to the rest of the body, except for the umbilical vein. Okay, so when you compare the oxygenation status of the ascending aorta, it is carrying oxygenated blood compared to the rest of the fetal body except for the umbilical vein, because umbilical vein is having oxygenation more compared to that of the ascending aorta, because it is straight away coming from the placenta. But due to a slight mix up here from the hepatic veins and here, what happens is the blood which is passing through the ascending aorta, we have the pulmonary veins also joining with the blood which is coming through the inferior vena cava, right? So there is slight mix up through the hepatic veins and there is a slight mix up through the pulmonary veins. And that is the reason why when we say the oxygenation status of ascending aorta, it is not that oxygenated compared to that of the umbilical vein. But when you compare the remaining part of the fetal body, of course, the ascending aorta will be having oxygenated blood. Now, what is the fate of blood which is passing through ascending aorta, or what are the major organs targeted by the ascending aorta? Because we just mentioned that ascending aorta is having maximum oxygenated blood. Okay, so what is the fate of this maximum oxygenated blood? It will pass through into the heart, then it will go to the head, especially the developing brain, then it will pass to the neck, and it will also pass to the upper limbs. So out of these four options, our main concern is brain, because brain suffers a lot if it is not receiving oxygenated blood. So our main purpose is to carry oxygenated blood to these four structures, especially the developing brain. Now talking about foramen ovale, what is the main function of foramen ovale? It shunts, so this is the foramen ovale, it shunts maximum amount of oxygenated blood into the ascending aorta so that the developing brain will get oxygenated blood. We just mentioned it. So what happens to the remaining blood in the right atrium? You know that this is the right atrium and this is the superior vena cava. Okay, and there is a small opening in the right atrium that is for the coronary sinus. So, in the right atrium, you have blood coming through the superior vena cava and you have blood through the coronary sinus. So, this blood in the right atrium, of course, it is not oxygenated. It will actually pass from right atrium to right ventricle and then it will enter into the pulmonary trunk. Okay, so pulmonary trunk will be carrying oxygenated blood, but the level of oxygenation won't be that much compared to that of the ascending aorta. Now, when the blood enters into the pulmonary trunk, this is our pulmonary trunk, it has got again two options. One is the major portion of blood can be shunted through a duct This duct is known as ductus arteriosus, and this is our descending aorta. Okay, so the main purpose of the blood in the pulmonary trunk is to go down through the descending aorta to supply the remaining part of the fetus, because we know the lungs is non-functional and there is no need for a major supply of blood for the lungs. So the blood in the pulmonary trunk, the major portion will be carried to the descending aorta through a duct that is known as ductus arteriosus. So 90% of the blood passes through ductus arteriosus into descending aorta in order to supply the remaining part of the fetal body. Whereas 10% of blood flows to the lungs. We know that the lungs are situated here. So the 10% of blood will be flowing through the pulmonary trunk in order to reach lungs. And we know lungs is non-functional, so there is increased resistance in the pulmonary system, but still the tissue needs blood. That is the reason why we are sending 10% of blood which is flowing through the pulmonary trunk into the lungs. Now, when we talk about ductus arteriosus, this is the ductus arteriosus. It is mainly the patency. It is kept open by two main factors. One is the low oxygen content, and the next one, the main factor, is prostaglandins, PGE2 and PGI2. So, indomethacin is actually an inhibitor of prostaglandin synthesis. When we are planning to deliver fetus prematurely, what happens is indomethacin will act as an inhibitor of prostaglandin synthesis, and that will actually in turn result in constriction of patent ductus arteriosus in premature infants, because otherwise what will happen is even after birth the ductus arteriosus will remain open. That should not happen. When we talk about descending aorta, this is our descending aorta. The blood in the aorta again flows in two directions. So when you talk about fetal circulation, you can always think like whenever the blood enters into one point, it has got two options. At whichever point you discuss, we can remember it like this. It has got two options. You have to know which are the two options. Likewise, as the blood enters the descending aorta, it has got two options. One is 35% of the blood enters the body of fetus. So this is actually representing the body of fetus. So 35% of blood which is passing through the descending aorta passes to the remaining parts of the body of fetus. Whereas 65%, so this is placenta. Okay, so this is 65%. 65% of blood which is passing through the descending aorta enters or reaches the placenta through umbilical arteries. Okay, so which are the branches of internal iliac arteries. So the umbilical arteries carry the blood which is there in the descending aorta, 65% of blood from the descending aorta to the placenta for further oxygenation and recycling. Now we will discuss about what are the changes you expect after birth. So circulation of blood through the placenta stops. We know after birth what happens? We will separate the fetus from the placenta. So there is no more circulation through the placenta, and of course the placenta will get detached from the mother's body as well. So it is just a dead structure after the birth of the fetus. So there is no more circulation of blood through the placenta. Now the next change is for the lungs of the fetus. With the first cry, what happens is the air enters into the lungs and the lungs will now become functional. So structures which are confined to the fetal circulation are no longer needed. So whichever structure is seen in relation with the placenta as a result of the vessels concerned with placenta are no longer needed. So which are the structures which are no longer needed after birth of the fetus? One, you need not continue to have the umbilical vessels. This is the umbilical vein, it is not needed. Umbilical artery, again not needed. Then you don't need the ductus venosus, because if there is no umbilical vein, you don't need any shunt for the blood of umbilical vein into the inferior vena cava, right? So there is no need for ductus venosus. Then of course foramen ovale, it is also not needed, because after birth what happens is there is less resistance for the lungs, because the lungs has started functioning properly. So there is more amount of blood reaching into the left atrium. So as a result, this foramen ovale will be closed. So there is no more need for foramen ovale, and the ductus arteriosus, which used to shunt the blood passing through the pulmonary trunk into the descending aorta, is also not needed, because now since the lung is functioning, the major quantity of blood which is passing through the pulmonary trunk should reach lungs for oxygenation, because we are no longer having the placenta for oxygenation purpose. So it is our lungs which we have to depend. So the ductus arteriosus is also not needed. Now, as the placenta gets detached, no blood flow occurs through the umbilical vessels. The umbilical arteries constrict soon after birth. So, when you compare the umbilical artery and umbilical vein, soon after birth, it will be the umbilical artery which will be constricting, because the placenta is a dead tissue. No more blood should flow now to the placenta from the fetus. That is, the fetus should not lose blood. What about the umbilical veins? It will remain patent for a few minutes, because it will let the maximum amount of blood which is there in the placenta to enter into the infant, because the placenta is anyway the dead structure. So it will actually squeeze the placenta so that it can extract maximum amount of blood from the placenta through the umbilical vein. So when you consider umbilical artery and umbilical vein, umbilical artery will first close compared to umbilical vein, because it has to prevent loss of blood from the fetus, but umbilical vein won't close at a greater speed compared to artery, because it has to squeeze out the maximum amount of blood from the placenta. Now about the ductus venosus, the sphincter in the ductus venosus contracts so that whole blood now enters into the liver, and then it will enter into the hepatic sinusoids, and through the hepatic vein it will enter into inferior vena cava. There is no more need for a shunt of blood through the ductus venosus. It has to, so the blood has to enter into the liver sinusoids. That is the purpose. Now when the lungs start functioning, what happens? There is decreased pulmonary resistance, and as a result what happens? The blood flow into the lungs will be increased. When the pulmonary resistance decrease, the blood flow to the lungs will increase. So as the blood entering into the lungs increases, the blood leaving the lung will also increase. As a result, what happens? The pressure inside the left atrium will be increased, because more amount of blood is now passing through the pulmonary veins into the left atrium, and there will be increased pressure inside the left atrium. As a result, what happens is this will push the septa onto the septum secundum. So this is septum primum. Okay, so this will be pushed against the septum secundum, and as a result, the foramen ovale will be closed. So when the foramen ovale is closed, what will be the fate of blood in the right atrium? It will pass to the right ventricle, and ultimately it will enter into the pulmonary trunk. So since the pulmonary resistance is low compared to the systemic resistance, what happens here? There will be increased pressure through the aorta when you compare it with the pulmonary system in the beginning, because the pulmonary resistance is more when there is no air entry into the lungs. Okay, so since the pulmonary resistance is low compared to the systemic resistance, blood will stop flowing from the pulmonary trunk to the descending aorta. So as a result, what happens is the ductus arteriosus, which connects the pulmonary trunk with the descending aorta, is no longer needed. That is what is happening when the pulmonary resistance decreases. So when the pulmonary, once again I will repeat, when the pulmonary resistance decreases, the blood flow to the lungs will increase. As a result, there will be increased pressure inside the left atrium, and that will be actually carried to the aorta as well. So the blood will definitely flow from a high pressure region to a low pressure region. Okay, so since now the aorta is having the pressure more compared to that of the pulmonary trunk, there won't be flow of blood from the pulmonary trunk into the aorta. That is very important point. Now the ductus arteriosus usually closes as follows. 20% of it will be closing within 24 hours and 82% of ductus arteriosus will be closing say after 48 hours, and 100% of all ductus arteriosus will be usually closing after 96 hours. That is the usual time taken for the ductus arteriosus to close. The factors controlling the functional closure of ductus arteriosus are high oxygen content, bradykinin, which is released by the lung smooth muscles. So what happens is when the bradykinin is actually released by the lungs, it will constrict the smooth muscles of the ductus arteriosus, and that will actually constrict the ductus arteriosus as a result of it. So anatomical closure of ductus arteriosus is actually by the transforming growth factor beta, TGF beta. Okay, so the ductus arteriosus, the factors controlling, once again, the factors controlling the functional closure of ductus arteriosus are high oxygen content and bradykinin. So the bradykinin is a substance released by the lungs, and that will actually constrict the smooth muscles of the ductus arteriosus. Now there is a condition known as patent ductus arteriosus. Patent ductus arteriosus, or PDA, is a condition where the ductus arteriosus is remaining patent. That means it is allowing blood to flow from the pulmonary trunk to the aorta. So flow of blood, as after birth what happens is, so before birth we know the ductus arteriosus will result in flow of blood from pulmonary trunk to aorta. So patent ductus arteriosus is seen in premature infants and persistent hypoxia, because we know high oxygen content is needed for the closure. So in premature infants and fetuses suffering from persistent hypoxia, there will be low oxygen content, and as a result what happens is there will be patent ductus arteriosus. So in this condition what happens is flow of blood from the aorta to the pulmonary trunk, because aorta is having high increased blood flow compared to that of the pulmonary trunk. So there is actually entry into the pulmonary trunk from the aorta through patent ductus arteriosus. So when the blood enters from the aorta to the pulmonary trunk, it leads to pulmonary hypertension and heart failure. Okay, so the blood will actually flow from aorta, which is having blood, high pressure blood, and that will actually flow from aorta to the pulmonary trunk, and as a result there will be increased pressure in the pulmonary system, that is known as pulmonary hypertension, and it will result in heart failure. So usually indomethacin is used to constrict the ductus arteriosus in premature infants, because premature infants, we have already mentioned that they are actually having a high tendency of having patent ductus arteriosus. So in premature infants, indomethacin is actually given to constrict the patent ductus arteriosus. Now when we talk about ventricles, this is the right ventricle and this is the left ventricle. Right ventricle is actually thicker since it is acting against resistance in fetus. In fetus, we know that there is increased pulmonary resistance because the lung is not functioning properly. Because if the lung is not functioning properly, the air blood won't be entering and there will be increased resistance. So actually, the right ventricle will have to pump at a faster rate and against resistance. That is the reason why the right ventricle thickness is more compared to that of left ventricle in case of fetus. But in adults, what happens is, there is increased flow of blood into the left atrium and left ventricle. So more amount of blood has to be pumped out of the heart in order to reach the different parts of the body. That is the reason why the wall of the left ventricle is thicker in case of adults. Now let's see what are the fetal remnants. That is, after birth we know all these important structures which we just mentioned as a part of fetal circulation are no longer needed. But still at their place you will be identifying some important structures which are considered as remnant of those structures. So umbilical vein. So we know this is the umbilical vein. That will be actually getting converted as ligamentum teres or round ligament of liver. Now what about ductus venosus? In this portion, instead of ductus venosus, again you will be seeing a ligament that is known as ligamentum venosum. What about the umbilical arteries? So this is the umbilical artery. So the umbilical artery, actually the proximal portion, this small portion, will be actually forming superior vesical artery, and the distal portion, this will be actually seen as a ligament that is known as medial umbilical ligament. So since we have two umbilical arteries, you will be getting two medial umbilical ligaments. But since we have only one umbilical vein, you will be getting only one round ligament of liver. Now what happens to the foramen ovale? The foramen ovale here will be seen as a depression when you look from the right atrium. Okay, so this depression, when you look from the right side onto the interatrial septum, that is known as fossa ovalis. So this depression is actually caused by the septum primum. Okay, so it is the septum primum which is actually seen at the fossa ovalis. So when you look from the left atrium, the depression here, this is actually known as lunate impression. So these are the two impressions which you will be seeing on the right and left side of the interatrial septum. So the septum primum will be actually forming the floor of fossa ovalis. What about septum secundum? So septum secundum will be coming from above. The lower border of septum secundum will be actually forming limbus fossa ovalis. What about ductus arteriosus? This will be seen again as a ligamentous remnant that is known as ligamentum arteriosum. So when we talk about main events in the fetal circulation, we have to first mention about the important structures seen during the fetus is inside the womb, and what are the changes happening for these important structures after birth. That is how you discuss fetal circulation. So it is the main events towards the end of the fetal life, and as soon as the baby is born, are closure of foramen ovale, closure of ductus arteriosus, establishment of pulmonary circulation. So in order to summarize, we have already mentioned that there is ductus venosus, foramen ovale, ductus arteriosus for the continuity of blood, so that there is oxygenated blood reaching the ascending aorta for the developing brain. So that is the reason why we are having many shunts to prevent the deoxygenation of the blood. Then you have the umbilical vessels which are carrying blood to and from the placenta, because placenta is acting as an organ of purification or oxygenation since the lung is not functional. And after birth, we know these structures are actually disappearing by leaving a remnant inside the body of the baby. So we have seen all the remnants as well. So that's about fetal circulation. Hope you have understood. Thanks for watching.